What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. And if you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, October 7th, 2023. We do have multiple news stories to share with you today. And then we have some other things. We're going to take a look at that leaf peeping that I was telling you about yesterday. Let's see how the crowds are up there. And not as big because it is raining up in New England, but nonetheless, that means people have to go indoors, so COVID will continue to spread there. Starting off in Montana today, state health officials encourage Montanians to prepare for the respiratory illness that includes flu, RSV, and COVID. Speaking of flu, the first influenza death reported for the 2023-2024 season was recently confirmed in Cascade County, Montana. So that's not good. Already a flu death in Montana. All right, let's switch gears to COVID. Let's switch gears to my website for a second. I think I may have told you this recently. If I didn't, I'll tell you about it now. I added another board section to my website for COVID legal cases. There seems to be a lot of news stories revolving around that popping up recently, and I did a little research last night. To my surprise, the Department of Justice, if you type in COVID fraud or whatever, COVID legal, COVID in general, a ton of stuff comes up. And I'm not just talking like a couple dozen, hundreds, thousands of cases pop up, and right now, there is a lot of, I guess, the backlog of stuff that happened during the height of the pandemic. Remember, we're still in a pandemic, but during, like, back when it was still a bigger deal to people, there's just, like, when people were getting money, loans, those loans that you would get that were, forgiven, you wouldn't have to pay it back. There's fraud going on with that. And then there is also this. This is something I thought was very interesting. Family who sold fake miracle cure for COVID sentenced to more than 12 years in prison. Leaders of Genesis 2 Church of Health and Healing who sold toxic bleach as fake miracle cure for COVID-19 and other serious diseases sentenced to more than 12 years in federal prison. And if you click on this, there were multiple people within a family that were involved with this, and guess what? They got caught. We're starting to see a lot of cases like this where people get caught, and then, like I said, there's also deals with fraud going on. 5 men plead guilty to roles in multi-million-dollar COVID-19 relief fraud conspiracy. I mean, maybe they're putting in businesses that don't exist. Who knows what the case is? There's all kinds of weird stuff that's going on. So you get the general idea here. I mean, just last night alone, I added 4 things, and I'm sure I'll be adding more in the near future because I continuously keep seeing news stories pop up. Now, moving on to this. COVID-19 cases and deaths slightly rise in Italy as positivity rate increases, and we can see here the looks like the numbers are going up pretty significantly. It says there were 44,139 new infections recorded in the week from September 28th to October 4th. This represents a 13.8% increase, and it says here that there are now 137 deaths recorded, which is more than the previous week's figure of 129, and the positivity rate is now at 16.3%. And now we move on to this. The latest COVID-19 news and case numbers around the territory. This is for Australia. So Australia is seeing cases throughout their different regions. Australia is made up of different regions and territories. Let's just go through a couple of them. Australian Capital Territory, 168 new COVID cases, no new deaths, 8 people in the hospital. New South Wales has recorded 1,541 new COVID cases, down from the previous week's total of 2,232. There are 643 cases in the hospitals, 14 of those in intensive care units, so that's not good, and 9 new deaths. That's relatively high. Northern Territory, 187 new cases between September 15th and the 29th, and it says 13 patients in the hospital, 109 deaths. Says the next update will be on October 13th. That should be this upcoming week. Queensland reported average daily figure of 72 new COVID cases over the week from October 3rd, meaning the state recorded about 500 new cases for the week. An average of 78 people were in the hospital. South Australia, 645 new COVID-19 cases as of October 3rd. It had 27 patients in the hospital. No new deaths. Tasmania recorded 275 new COVID-19 cases in the week leading up to October 5th. The state has 16 people in hospital. Since 2020, they have 312 deaths. Victoria has recorded a daily average of 193 in the hospital with COVID, up from 168 last week. The 7-day average of ICU patients has risen from 5 to 8 people. Western Australia has 660 new cases. There were 15 people admitted to the hospital, with one in the intensive care unit. There were 5 new deaths. So yes, an update on Australia. That's something we haven't done in a really long time. So I'm glad I found that. Then we come over to this new study. It's not a good study. Studies suggest higher risk of new onset post-COVID autoimmune and autoinflammatory disorders. So the risk of them, if you get COVID right now, is relatively higher. So that's sort of a bad news study. It's a good study itself, but the news that comes of it, it's not good. It's just more reasons to not catch the virus. Now this, on the other hand, is bad study. This is just totally ridiculous. It's not just long COVID. Symptoms can linger after other illnesses, leading to long colds. Come on. Long colds. That is a slap in the face, literally a slap in the face to anyone who has long COVID. Oh, but you may not have long COVID. Au contraire, it's happened with colds previously before COVID. Have you ever heard of anyone say the word long cold? Let's just say 2005, 2015, 2017. Yes, in rare cases, yes. I'm not saying you can't have a new issue develop after a cold, flu, or anything else. I'm just saying it wasn't very common. It definitely was not talked about in the news all that much. And now all of a sudden, suddenly someone said, you know what? Everyone's saying long COVID this, long COVID that. How about we come up with a study where we see what happens after a cold? And then we can debunk that, and then we can normalize people getting long COVID, since long colds were always a thing. No, it doesn't work that way. They're just trying to minimize anything in relation to COVID. They're trying to say, well, see, this has always happened, so you can't just sit there and fearmonger about COVID all the time. No, it's a real deal, and it's a very contagious virus, and we know a certain percent, which always seems to be changing, which at this point maybe it's rising right now, a certain percent will go on to develop long COVID. So don't give me this business saying, oh, well, it's always happened with long colds. No, this is one study. There's a trash can right here. Guess where that study's going? Whoosh, right into the trash can, because this is nothing but minimizing. Then it comes to something else that kind of is concerning to me. I want you to hear this. I hope you can hear this. I'm going to make sure the volume's up so you can hear this. This was last night in Center County, Pennsylvania. We're going to have the volume up. I want you to listen to this.
25 for your response. Hollis Township, 1930 Cliffside Drive at Juniper Village, room 116, 100-year-old male, COVID positive, difficulty breathing, O2's at 87%.
So, what that you just heard was a dispatch in Center County, Pennsylvania last night for a 100-year-old person, COVID positive, Juniper Village. That's a long-term care facility. That's a nursing home. Yeah, 100 years old. What are we doing? We're supposed to be protecting our seniors. We're supposed to be protecting our elders. Clearly, we're not doing that right now. It is so sad to hear someone who lived to be 100 years old, probably lived a great life, maybe a healthy life, I don't know, and now they're 100 years old and they catch COVID. Come on. We need to be masking in healthcare. We need to be wearing these masks. Come on. Nursing homes, if you're going to visit someone, Put on a mask. Keep them safe. The other thing I see so many of on the news, and maybe this happened in this case. Oh, someone just turned 100 years old. Let's have a birthday party for them. Let's have the whole senior community come down and wish them a happy 100th birthday. Here's the problem with that. You do that, they may not live to 101. You're all gathering together, congregating. I'm sorry, but it's still pandemic times. It hasn't ended. At least put on a mask when doing that. I mean, this is just so sad to hear someone 100 years old, COVID positive, difficulty breathing, O2 saturation dropping below 90. It's just sad to hear that. Moving on now, I told you we would check in on the leaf peeping territory in New England. Not as big as crowds as last year. Last year definitely had bigger crowds because of the weather, but nonetheless, people still did flock up to places in New England. Let's take a look at Google Maps and see where these places are. Here is Stowe, Vermont. Wow, check this out. Look at the traffic in Stowe, Vermont. It's just maroon, bumper to bumper. That's telling me that it's just jam packed with people. I've been to Stowe many of times. I have relatives that live in Stowe. Take a look at the mountain road. Again, not as busy as last year. This was all maroon. But as you saw yesterday, when you can come down here, here's Montpelier. As we saw yesterday, wastewater in Montpelier is rapidly rising. Take a look down in Waterbury. Now, I can't show you wastewater for Waterbury or Stowe, but I can show you this. This is the next best thing. I can show you right now how crowded it is there. And look at Route 100 in down by 89. Yeah, look at all this traffic. So that's telling me these restaurants are probably crowded. If I was to click on them, we could see the busy indicator. I assume that they would be way up right now. Let's see what's going on in New Hampshire. Again, no, not seeing the crowds that we saw other years. I recall last year taking a look at this. Is Route 112 over by Route 93. Woodstock, New Hampshire, if you're familiar with that area. This was all backed up for miles last year. So again, poor weather has led to smaller crowds, but nonetheless, a lot of people still did flock up there. Look at North Conway. This is up near Mount Washington. Again, there's a lot of restaurants there. There's a lot of people that are going to be close together. So we're definitely going to be watching for some COVID cases here. Just not as big of a deal as last year because, again, it is raining up here. Here's Freiburg, Maine. That's another spot that usually gets packed. They usually have a festival up in Freiburg. And just not as crowded as last year. Alrighty, moving on. Let's take a look now at air quality values. And we're going to be seeing better air quality values moving into the east. Remember yesterday I said air quality values are going to start to improve? Look at this. Voila. For the majority of the country, it's fine. But you have to take a look at the West Coast. There's some really bad air qualities that are evolving now in California. I'm thinking since yesterday we might have some new wildfires. If anyone's watching from California, let me know down below. I have not checked the news out there today, but yeah, this is not good. This is a big increase from our update yesterday. And look at this near Reno, Nevada. What's going on here? Why is there a purple site there? Is there a fire there or something going on? That's not good. And we take a look at Oregon and Washington. It's increased there as well. So something's clearly going on out there. I'm going to investigate it. If we do have a Sunday edition of the update, which I think we may this week, if we do, I will report to you on that, what that is. We got a few random high sites in Texas as well, which that could be a product of some sort of a incident that's going on that's causing air quality to be bad at this time. Taking a look at Walgreens, the national positivity dropped by 1% from 28 down to 27% because testing was up. 11,284 people got tested this week. The previous week was 10,209. Now let's go over to Hubbub World and their data. We have not looked at this in a little while, and we can see here that if you've never been here, the website you type in is hubbubworld.com. I'll have it listed down below. And, of course, the link is also on my website in the sources that I use from the pandemic updates. What they do is local prevalence for COVID. They do local prevalence for flu, RSV, and also influenza. And it's basically how many contagious persons are living within a 5-minute walk of your area. And you can see here, along the I-95 corridor, you're starting to see some brighter colors in the east. That's because it goes from 0 to 20, and when this is interactive, at the moment it's not working for me, but when it's interactive, you can actually see the actual number, and it can definitely go way above 20 at times. And right now, that's the case in New York City. That's the case in a lot of the metro areas. Then you come down here to Florida, and you can see there's a darker color area as well in Florida down by Miami. Still some high prevalence there, but at this point, these areas of Florida, we know Florida as a state, cases are coming down a little bit. Another state where cases are coming down is Texas, but you still have some high areas where there's a high number of contagious people within a 5-minute walk. That same thing can be said for Chicago area as well, up in Illinois, and even up here as you come near Green Bay, it's still relatively high. Then we also see a concerning area in California, down in Southern California, LA, and down as you get down to San Diego, and then further north in California, up in the Bay Area, there's some coloring there as well with moderate to high prevalence. Also, if we go to the Pacific Northwest, Portland, Oregon, and Seattle, still moderate to high. And then we do have a whole bunch of other metro cities spread out throughout the country where you're still seeing some coloring, like Ohio, Columbus, Ohio, Cincinnati, Ohio, St. Louis, Missouri. Then you come over to Denver, Colorado. There's some coloring there, so that means its transmission still high. When we take a look at flu right now across the country, it's still relatively low. We're starting to see some rising numbers down in Florida, North Jersey, New York City, and, well, as you know, when we started this video, Montana reported its first flu death of the season. Although this map shows the levels are currently low there already was one death. Who knows? Maybe this is going to be a bad flu season in terms of deaths, considering low levels and already the first death up there. And I'm sure there will be other deaths across the country soon. We're going to try and get those numbers incorporated into the pandemic updates. RSV, a little bit more prevalent than flu at this time. You can see at the West Coast there's some concerns. Down in the South there's some concerns. Also some concerns in the Great Lakes. So yeah, this is something that we're watching. RSV. And remember, there is now an RSV vaccine that can be used. So if you haven't gone and got it yet for your kids, for your child, now would be a good time to do that, because RSV prevalence is starting to rise, and influenza-like illness in general. Do I need to say much here? Yeah, the East Coast, any of the metro cities right now are dealing with really high levels of influenza-like illness right now, so not good to see. Now let's take a look at Chicago. We do have some updated numbers out of Chicago. Hospitalizations, unfortunately, the daily average has increased to 18 from 17. Beds in use, though, is down ever so slightly. That's overall beds in use. Emergency room visits, they're down slightly. It also says cases are down slightly. Number of vaccines administered, that's down slightly as well. And looks like deaths overall are flat at this time. Taking a look at New Jersey today, New Jersey hospitalizations, they're down a little bit. 612 people in the hospital. And we also have some hospitals not reporting there. Only 67 out of 70 reported. 20 people on a ventilator. 60 people in the ICU. Let's go across the Delaware River, come into Pennsylvania, and yeah, Philadelphia. It was very busy yesterday. We suspected it probably would be because the suburbs were just slammed with EMS calls yesterday, and yeah, there were 827 EMS calls in Philadelphia County yesterday. Let's do a live look in at the suburbs, see what's going on. Wow, Montgomery County right now, still 14 incidents. It was 16 incidents a little earlier, and I think it got near 20 at one point today. I'm seeing cardiac emergencies, there's vehicle accidents, there's respiratory emergencies, there's dizziness, fall victims, subject in pain, cyclical episodes, vomiting, yeah, you name it. How about Chester County? All right, Chester County's not as busy as what we were seeing yesterday, but there is still calls here, so yes, it's something we have to watch. We do not get updates out of New York State this week, and these are the same numbers I gave you from last night, 2,927 new cases, and it's the same deal with hospitalizations. They do not update on the weekends, and pretty much the rest of these states, we will not get updates again until next week. And remember, next week is a holiday on Monday, so New York State's next update may not be till Tuesday, and the start of the new week may not fall until Wednesday of next week because of the holiday. Let's just quickly quickly take a look at an international update here. Russia cases are up by 14%. Singapore cases are up by 3%, though I think this number is actually probably higher than that. I'm seeing some news stories saying that they are seeing increases in hospitalizations at this point. And there are a few other places that are seeing cases rise. We are seeing cases drop in a few places as well. It's saying here Canada is down, but I don't know if I'm buying that. This very well may be wrong because much like the U.S., when the U.S. was rising throughout the majority of the summer, it kept saying cases were down here. So I'm not buying that whatsoever. Germany cases are still up 8%. Deaths are down 9%, 104 versus 114. Alrighty, folks, that does it for today's pandemic update. We'll have another one again in the near future. We may have one again tomorrow if there is enough news. We'll just have to see. I'll try and put something together maybe for tomorrow, and check my other channel. At some point we are going to do a climate update. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And if you know anyone that needs to see content like this, by all means, please share this with them. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon.